Tuberculosis and pulmonology clinics like this one at the Sacré-Cœur de Montreal Hospital say 2024 was a busier year for tuberculosis treatment. This doctor says she welcomed about 35% more patients into her office for TB consultations compared to 2023. They are sent here because they have tested positive for the infection, so it's our job to find out if it's an active or dormant case, she says. The bacterial infection most often affects the lungs and can be fatal if not treated. These days, it's much more common in impoverished countries where living conditions are poor and access to health care is difficult. According to Montreal Public Health, active TB cases were up by 54% in 2024 for an average of 9.4 cases per 100,000 people. That's compared to an average of 6.1 cases per 100,000 people between 2010 and 2023. That's much more than the province-wide increase, which is about 20%. Montreal Public Health says the majority of infections are diagnosed in people who were exposed in countries where TB is widespread.
This reflects really large numbers of people who've come in, particularly as refugees or refugee claimants, in the last couple of years.
Experts say this increase isn't something the general population should be worried about. New arrivals to Canada are tested for TB, and it's generally well monitored in the healthcare system. They say it's also not the kind of infection you can catch from someone on the bus or at the grocery store. You have to be exposed to someone with an active infection for hours, which is why spread is more common between people in the same household. But in Indigenous communities like those in Nunavik, the situation is much worse, with a rate of infection about 200 times greater than the rest of the province. Health experts say crowded living conditions and tougher access to care in the area are behind that, something the community is working to change.
It's things like getting an X-ray. Well, sometimes people in Nunavik cannot get some parts of that diagnostic cascade in their home community, so it means that you have to fly out somewhere else.
In a statement, the provincial health ministry says it's monitoring the situation in the most affected regions. It says it's in touch with local health authorities and is ready to offer any necessary support when it comes to screening and keeping the infection rate under control. Sharon Yonan-Reynolds, CBC News, Montreal.